An appeal is being made for a government-funded hospice in Jamaica. Consultant oncologist Dr. Dingle Spence says there is not enough space to adequately care for persons who are terminally ill, especially those who are diagnosed with all types of cancer. TVJ Shamela Pullen explains in this week's edition of The Health Report.
The Health Report and hospice means a place of shelter. It is usually for someone who is terminally ill and has a life expectancy of less than 6 months. Hospices usually involve care to relieve troublesome symptoms and providing psychological and social support for the patient and family. It also enables the person to live to the fullest, even with a terminal prognosis. Consultant oncologist Dr. Dingle Spence says there is currently no government-funded hospice in Jamaica to facilitate such care. Dr. Spence says at the moment there are only 2 private hospices in the country, and that's not enough given the rise in cancer diagnosis.
We have a very small hospice in Kingston called the Concy Walters Cancer Care Centre that does great work, but they only have 8 beds, so that's pretty small. And then there's a hospice in just outside Montego Bay called the Hope Hospice that I think has a bigger capacity, maybe about 20 patient spaces there. So I would say we're greatly underserved for a population of nearly 3 million, that we only have 30 hospice beds in the country. That's sad.
As a result, patients suffer because they're unable to get the adequate cancer care. Dr. Spence says sometimes these patients are discharged from hospitals and have nowhere to go. It's a part of the reason, too, some refuse to leave public health facilities. Dr. Spence says when compared to other countries in the Caribbean, Jamaica is behind in making adequate preparations for cancer patients.
For instance, in Trinidad, it has a population of, say, 350,000 people compared to our 3 million people. And in Port of Spain alone, they have 3 hospices. So, they're way ahead of us in understanding that type of care and how important it is to be able to provide that type of care to very sick people.
Dr. Spence, who has been working with cancer patients for decades, is hoping that the government can recognize the need for a hospice. She also wants to see the government working closer with medical experts to fix the problems.
We do make appeals on occasion to the government in our reports that we write, pointing out that, this is a need. And I think what we really need to do as advocates is to carry that to the next level and see how we can actually write a proposal that would be appealing to the Ministry of Health.
With her health report, I'm Shamela Pullen wishing you good health. The Health Report